Welcome back, everyone, for part 2 of our time with Dianne. Here, let me go up to this. This is Dianne Morrill with Nexus Health Solutions. She did an intro in part 1 about everything that she does and about her background. But we're really excited to just dive into the meat of the next section of our discussion, which is innovative compounded products for your practice. And, take it away, Dianne. Like, you got so excited about peptides because of what it could do for your health and how it really affected your life. But for those of us who are completely new to peptides and understanding like what they can do and how to administer, and I guess give us an intro to all that.
Yeah. So, I kind of jumped right in last time with my history with a peptide called BPC 157, which saved me from neck and back surgery and really gave me my quality of life back. I highly recommend going back to that webinar and just taking a look at it because it really just walks through what peptides are capable of. But where I, really left a gap there is I didn't properly explain what a peptide is.
Yeah, let's hear it.
And yeah, so a peptide is just a combination of amino acids. It is a chain of amino acids in a very specific sequence. And what that sequence does is it communicates with your body in a way that it activates or amplifies what it is already capable of doing. So, you're realistically feeding it a very specific nutrient sequence to help it along its path. So you're just giving the body exactly what it needs. And these peptides can be so incredibly powerful. I get patient outcomes all the time where it is absolutely life changing. They go from being totally debilitated or struggling with autoimmune conditions or GI health or cognitive components. There's just so many ways that peptides can really influence. There's thousands of peptides. So it's really just leveraging them in the way that is going to benefit the patient the most. And a lot of people don't realize this, but GLP-1s, they're a peptide.
Peptides. Yeah.
Yeah.
I try and explain that they're not a drug in the traditional sense. Like people are like, think this is a medication. I'm like, it's a signaler. It's just telling, your brain and your gut to do the things that it was doing anyway, but in a better way.
Exactly
Question,
right.
is a peptide in hormone, because GLP-1 is like a hormone as well. Tell me a little bit about like how we might use those terms. They're not exactly interchangeable, but are all hormones a peptide, or I'd dig in there.
No, yeah. So there's only a couple of hormones that are realistically considered peptides, and the major difference there is primarily peptides are going to signal an increase in hormone production rather than introduce hormones exogenously, kind of a thing. So that's going to be your primary difference. It's more of a carrier than it is a instigator, I guess.
It's a messenger, not the message. Right.
Exactly right.
Yeah.
Thank you. Yes, that is a perfect analogy. I'm going to steal that. Um, yeah, so that's a beautiful way to put it. You're absolutely right. It is a messenger, not the message. So it can help amplify hormone production, but it's not necessarily going to introduce it exogenously.
Love it. Thank
Cool.
you.
So what kind of what peptides, like maybe pick the top 3 where you're like, this is a really safe option for people to offer really great benefits to their patients. What would you say?
Well, so there's some key pieces that we need to walk through from a regulatory
great.
standpoint here.
Let's do it.
And, a lot of this comes back to the FDA, overstepping. So one of the big pieces that they just implemented late last year was a massive ban on commonly used peptides, which have been demonstrated in clinic and even clinical studies to be safe and effective. Now, I say that with the caveat of this: the FDA has said no compounded product can be considered safe or effective. So, you have to take that with a grain of salt from a marketing standpoint. Make sure
Right.
you are not saying compounded products are safe or effective. That is going to get you into some, hot water. And also for your GLP-1 marketing, make sure you are marketing as medical weight loss, prescription weight loss, GLP-1s. Never, ever, ever reference the commercially available equivalent. That is where you will get a trademark lawsuit from the commercially available equivalents. And frankly, they just have too much money to even entertain.
You're going to lose.
Yeah. Yeah. Even if you win, it's still going to hurt.
Yeah.
Yeah, you're going to be bankrupt.
Yes. Yeah, exactly right. So, there's some key pieces there. And with that being said, they have actually banned 19 of the most commonly used peptides, including BPC 157, which is one that is really close to my heart. We talked through that earlier. But that is where we have been working to source some alternative options that do offer some very similar therapeutic benefit. But what that does also means is peptide access is very limited these days. So you're primarily limited to commercially available alternatives, which are going to be from a sexual wellness standpoint. PT 141, the commercially available equivalent is Vyleesi. It is FDA approved for female sexual dysfunction. It is a good one. Off label, it is also phenomenal in men. And one of my favorite parts about PT 141 is, rather than it being, focused on like your PDE5 inhibitors, rather than it kind of acting on that mechanism, it's acting on your central nervous system. So you get this full body kind of benefit, libido enhancement, sensitivity enhancement. There's just an overarching piece here where it can really influence female sexual desire and orgasm, and even in men. So in studies, they had originally pursued PT 141. It's a derivative of melanotan 2, which is considered the Barbie doll peptide. It's no longer available; it's banned. But when they originally were doing studies, they wanted it to be a tanner. So they were doing clinical studies around influencing self-tanning, which it's phenomenal for. It's also got some anti-cancer, like anti-skin cancer benefits and stuff like that. But what happened in the studies is 80% of men and women ended up significantly aroused. And so they were like, oh, we might need to adjust this. And so they started studying what they felt was the derivative responsible for the sexual influence, which is PT 141, also known as bremelanotide. And they found that 8 out of 10 men got an erection, and women tend to see a 50% increase in their level of experience. And I will tell you, I'm very open. I'm going to get into some nitty gritty. We're all medical here.
Sure.
It is what it is.
Fine. Yeah.
From a personal experience standpoint, I am prone to nausea, and that is one of the primary side effects with PT 141. So the first time that I did it, I felt kind of icky for a day or two. I didn't really enjoy the initial experience. And it's not like I was puking. I just didn't feel great.
Yeah. Fell off.
Yeah. Side effects and benefits improve with continued use. So if you do not enjoy the first experience, give it another shot, pun intended. So the second experience was probably the best orgasm of my life.
That's awesome.
It is a winner.
I'll take two.
You've only had two. So is it one of those medications you just take PRN essentially? Like you have it like kind of like they prescribe for Viagra? Is that it's a PRN sort of thing?
Yep. So common protocol is, a subcutaneous injection, 30 minutes to 4 hours in advance of, sexual activity. Now, here's the caveat to that. The half-life of it is 72 hours. So you are going to see that enhancement for 72 hours. And it's not like with Viagra or anything like that, where, when men take it, they've got to get some stuff done right away. And there are occasions where priapism happens, like stuff like that, where it doesn't necessarily resolve after coitus. With PT 141, it is not putting you in a position where it's like, oh, now's the time. I mean, it can be, anytime can be good with PT 141, but it's not like imminent. It's like, okay, I'm ready to go at any point. It's not, it has to happen right now. So that's the nice thing about it, is it influences that entire system in a way where it just really prepares you and gets you in the mood, but you don't necessarily have to take care of it immediately. And because it is effective for up to 72 hours, you really don't have to take it more than once in a given weekend. I do recommend taking it first thing in the morning alongside coffee. Caffeine makes a big difference for that nausea component, especially if you're prone to it. But again, side effects and benefits improve with continued use.
Cool. All right. Well, that's a fun one. And that is something that's available at First Choice?
It sure is. Yep.
Awesome.
And there's a variety of options there. Now, injectable is definitely the most effective route of administration. And again, it's just subcutaneous injection abdominally. You're not looking at any kind of like significant, exertion there. Like intracavernosal injections, they've got to inject that into the penile
Mhm.
cavity. That can be a little bit of a struggle to overcome for some men.
Sure.
This is a really great option. There's also an intranasal version, which is beneficial but less significant than the injectable. And then there's also an oral option, which I primarily have only seen benefit in men. So if you're going to go the oral route, there's a great combo. I like to call it our bliss troches or our bliss tabs. You can do a combination with sildenafil or tadalafil. My personal preference is tadalafil. Sildenafil can cause some nasal congestion and just some overall pieces that aren't as
Vasodilation. That
yeah,
makes
yeah, yeah,
sense. Yeah.
yeah. And so I personally prefer the tadalafil with the PT-141, and we can either combine that with oxytocin or apomorphine, which can
Oh.
significantly influence that response. So those are some great combos for men, especially if they're needle shy. But for women, I definitely recommend the injectable over any of the alternatives.
Great. Any other peptides that we should really look out for, you think, that are awesome, that are compliant?
Yeah. So penadecapeptide arginate.
Oh, that's a
That is
mouthful.
going. It is a mouthful. PDA for short.
Okay.
And what that is representing is penadecapeptide is a chain of 15 amino acids. If you take a look at BPC 157, it is a combination of 15 amino acids. The
Oh,
arginate salt form of BPC is the preferred salt form. I think we can make some crossover here without me specifically saying, but it is a very, very similar form that is compliant with the FDA ban on BPC, and allows continued compounding with the exact same outcomes that BPC had previously offered.
oh,
And that one is,
that's fascinating.
yes. So that one is phenomenal for pain management, injury repair. I've seen some benefit in, arthritic forms. So OA, RA, a lot of those pieces. It's a really good one. Um, I have seen where it's gone intra-articularly. If you guys are comfortable with that, you can see phenomenal progress for joint issues. And then orally, it's originally derived from a gastrointestinal protein. So it is actually intended to help benefit GI components. So IBS, Crohn's disease, ulcerative colitis, chronic ulcers. There are just a lot of mechanisms where BPC or now PDA have seen significant improvement in those pieces.
Would that also, because there's such a gut, the overlap between autoimmune disease and gut, and while we can't put a finger on it, it seems like that would also be a good indication.
You're absolutely right. There are significant links between gut health and autoimmune conditions. There's also the gut brain axis. And so,
Mm.
there's some really interesting studies that are starting to come out from psychiatric facilities up in the Northeast. And what they are finding is that some of these psychiatric conditions can actually be linked to underlying untreated autoimmune conditions. And there's a
Mm.
really interesting case study that they just did where a completely comatose patient had been for over a decade. They treated her underlying autoimmune condition, which I think was Lyme, and she is now a functioning member of society.
Shut up.
Yeah. So it is, there's some really cool things that are starting to come out right now around these pieces that I
Hmm.
think we are going to see some major changes in the industry. And they're starting to look at these pieces. And like, even if you look at interstitial cystitis, that is an
Hmm.
autoimmune condition that is commonly linked to gut health. So, there's some critical pieces here. And I actually have a urogynecologist. I've had this theory for years that BPC could solve IC. And he actually started putting it to the test. And so he has been doing um, injections into the actual cavity and
Mm.
been seeing significant improvement, if not complete
Crazy.
resolution. And this is a condition that previously really had no great options, and it was
Yeah.
incredibly painful.
Yeah.
Just something that women really struggled with. And so, there's some really exciting things that are happening right now.
How is it best for people to learn about it? Because, this is obviously out of the purview of most of us, and we don't have any education. How do we learn to use these medications safely and effectively?
Yeah, so the Advanced Practitioners Network is a training and education network that offers training on peptides. I am obviously very well versed in it as well, and I'm happy to help them get onboarded and comfortable with this. We actually partner with Dr. Luis Martinez, and he is absolutely brilliant in this realm. He's also known as Dr. Ageless, so is very well versed in the regenerative med landscape. Peptides are kind of his niche. And so we lean on him really heavily. So, a nice thing is in that CAG favorites formulary that I've shared you guys on, I've gone ahead and built out kind of the most common formulations and protocols as well. So now I do want to add the caveat. I'm not a doctor. I'm not a pharmacist. I'm a nerd with an eidetic memory. And so ultimately, the pieces that I am providing, I am not offering medical advice. What I am doing is I'm letting you know the most common protocols that I've seen because I've been in this industry for so long. I have connections who do this very, very regularly and have demonstrated safety and efficacy, and ultimately have demonstrated the highest outcomes possible for patients. And ultimately, I think that's what we're all trying to achieve. So, I want to add that caveat of, any protocols that you guys move forward with are at your own risk, at your own decision.
Yes.
These are all going to be your primary points, but I am here to help you along that path and provide insight as to what is most commonly done.
Wonderful.
Yeah.
Thank you for that caveat. And we say that
I've
too, like
got
you
one.
mentioned doing an intra-articular injection and, oh, that's fun. I'll stop sharing. Like if you're not comfortable with that, please don't, like if this feels completely out of your depth and you're not ready, please don't. So there's lots of things to learn. And when you feel comfortable, please, think about considering adding it to your practice. Diane's also put in a bunch of topicals. I know we're coming up on time, but, there's a lot of great compounded topicals that are also for anti-aging that are fantastic and also have a great history of safety and efficacy. So take a look at all those options that are going to be in the formulary that's available to you through First Choice.
Yeah, I wanted to piggyback on that kind of like warning because recently we heard in Dianne, you might have know more about this, some like nurse practitioners getting in trouble for doing exosomes IV and things like that. And when you do talk to exosome companies, they're like, yeah, we've got this protocol for IV. And so like what you can get in trouble, like what you might feel is right or you think is good for a patient, and maybe there's evidence behind that. You've mentioned the FDA multiple times. You are ultimately the one that has the responsibility for making sure that you are in compliance with the FDA. And when you do start dabbling in things that are not FDA approved, whether it's not FDA approved microneedling device or whatever it may be, there's a whole spectrum. But once you start injecting things into people's joints and intravenously and stuff, this isn't something to take lightly. It's get educated on all the sides, and Suzanne and I are just getting educated. We're obviously walking before we're going to run on that. I know we have like just 1 or 2 minutes. I wanted to ask quickly about like Morrill. You hear a lot about that. Is that one that's been banned or is that still available?
No, that one's available. And that one's a great one. So with Morrill, it is a growth hormone alternative. Essentially what you're doing is you are influencing the production and release of your innate growth hormone. There are some specific nuances that you want to be aware of with that one. It's very rare to have any significant side effect. I've had 3 cases where there was a systemic histamine reaction, so kind of hives. And I had one patient who felt it didn't actually occur, but she felt like her throat was kind of starting to close, almost like anaphylaxis. It did not advance to that significant of a degree, but generally speaking, those reactions typically only occur with long-term use. So this is something that you do want to cycle. As far as what the protocol looks like is it's going to be 5 nights a week. And what you're doing is you're trying to minimize the potential to overstimulate your pituitary and hypothalamus, which is how your growth hormone is produced. Growth hormone is also naturally released overnight. So what you're trying to do with the nightly dosing is amplify that overnight overnight reduction or production. Now, there are some patients that kind of get jazzed on some Morrill. If that's the case, they can switch to AM dosing and they can get kind of a secondary release. But generally speaking, nightly is going to be your best option. Again, 5 nights on, 2 nights off. And then after 90 days, they want to take a 2 to 4 week break just to prevent kind of over acclimating to the medication or developing that histamine response.
Yeah, love it.
Cool.
We
Great
can
info.
talk about all these different things all day. And if you want to talk about all these different things, Dianne is your contact person through the Injectables EDU purchasing group. So you have full access to Dianne. She'll be the one holding your hand, helping you with this. Final 2 cents is check with your malpractice insurance for any new thing that you bring on, any new medication, any new service. You need to check with your malpractice and kind of get that touch point as well.
Real quick on that tip, because that's a great call out. If you need a medical malpractice insurer that insures for peptides, I have a connection there also. Yeah. And the other thing that I do like to note, because, one of the big pieces in medical malpractice insurance right now, specific to GLP-1s, is they want to know what salt form is being dispensed. Neither, in none of the pharmacies we operate with use the acetate or sodium salt form, which is the form that the FDA has basically advised against. All of them use the base form, so you will not have any issues with your insurance from that end.
Yes, having just gone through a renewal, that was a big thing. It's like, are you using the salt form? Not that it actually really has any meaningful clinical outcomes, because I think that 70% of all medications we take across the country are the salt form. It has to do with shelf stability and ease of manufacture. So it's totally nonsense, but there it is anyway.
No, and really, why that came about is because the commercially available equivalent got their panties in a wad, and we're like, well, we had to go through this entire FDA approval process for the base form, and now these compound pharmacies, they just get to use a salt form, which, by the way, you're right, it's the history of compounding. Compounding is based off of alternative salt forms. So it's absolutely nonsense. And really, it was basically a margin grab.
Super.
Yeah.
That's
a webinar for another day.
That is. We'll talk about that.
Well,
so anyway, if you want to join our purchasing group, if you have more questions, feel free to reach out to us at Injectables EDU, and we look forward to working together. Thank you, Dianne.
Thank you,
You're very welcome.